Hello there, welcome to To Fcps Tips and Tricks of Surgery. I'm Dr. Reza Ahmed, consultant at Al Haramain Hospital. Today I'm going to present what you have to read in the OSPE. So let's begin with a quotation from famous all-rounder John T. Rhodes. He said about the saying that practice makes a man perfect, but the real thing is a perfect practice can make a man perfect. So you have to practice like you are going into the examination room and make it happen. So let's start. What you have to, what are the things you require to appear in the examination for OSPE in FCPS in Bangladesh? First of all, you need some instruments and some persons. You need about 4 persons to share your knowledge and 4 participants, because without 4 persons, it is quite impossible to appear in the OSPE. How? I'm explaining. First of all, the 4 persons, why they are required? Because uh, every time you will not get patients in front of you. So one person will be the patient, and one person will be the examinee, and one is helping, or one is the examiner. So you will learn how to question the examinee, and also you take part in the process, how to take part in this examination. So that's why 4 person is required, and they can, if you tag 4 persons in a team, they will go, they will make it happen. So first, what are the things you require? Instruments. You can see clearly. At first, you will require newspaper. Why? Because newspapers are required for draping sheet. You can act as a draping sheet. You can tie and knot in the newspaper for repair of the perforation, and also repair of anastomosis. You can use as alternate of a gut. Then you will require a rope. Probably a skipping rope is good, because you see, by taking part of 4 parts from a skipping rope, this is the caliber of the rope that is given in the examination. So you have to practice with this kind of rope with anywhere possible. If you have a ethicon kit, that is fine, but if you don't have a ethicon kit, you can practice in the in your window also, in the chair also. Then needle holder, tooth forceps for practicing the knots, tie. Ethicon practice kit, or you can self-made practice kit. Then you can require the roll bandage. You need a tab or a cellular phone. Why? I will tell you. And in the tab or cellular phone, you can put the belly love inside, and you can belly love and other books inside, and you can go wherever in front of the patient and just can see what is in there. If you have any confusion regarding any disease, you can go through the books and learn how to take part, how to take the examination, what are the questions you are asked. So in front of the patient, you require a cell phone or a tab, and you can read the book anywhere you want. Then you have to practice the referral. Referral means that in case of ward, you have to refer a patient to another professor. So you can practice the referral cases, how to write a note on the referral. Then OT note, operation theater note. It is very important. In the belly love, there is a pro forma. You can follow the pro forma and make about 20 OT notes, so that in the real examination, you don't have to worry anything. Then preoperative and postoperative notes. Preoperative and postoperative notes are very important. They are also coming in the examination. And you can see there is a patient, you are giving a condition with the patient with diabetes mellitus or hypertension or any comorbid disease. So how to prepare the patient in the preoperative note and postoperative note. Then you have to go to the CT scan, X-ray, CT scan, MRI, X-ray, because how can you read the CT scan, MRI, and X-ray? I will tell you later. And the gloving technique you have to do. So there is one book you have to read mainly. This is the Bailey Love. And also for OSPE, Shakwat Bhai's book is very famous and it is very handy to take with you and to read. So, how can you read the belly laugh? I'll tell you that first you have to go through all the pictures in the belly laugh, and here the X-ray, the CT scan that are available in the belly laugh. You just have to uh, make some identifying points in the CT scan, identifying points in the X-ray and MRI, and what is the diagnosis and what is the treatment. You have to make all the charts, all the pictures available in the belly laugh, and make all the diagnosis and the identifying points written down, so that when you get in the examination, one of them you should get in the examination, and you just don't have to worry. Just looking at the CT MRI picture or the ultrasound picture and the X-ray picture, you just instantly you can write and you can diagnose. This is why the tab is also required, because whenever you find an X-ray, whenever you find an X-ray CT scan in the side of the patient, you can just go through the book and also diagnose it properly. So thank you. I will discuss later on the uh, clinical part for long case and short case. Thank you.